Do you have painful period? Worsening painful period? Do you have painful sex that the pain actually outweighs the pleasure? It could be endometriosis. Today, we'll be discussing endometriosis using the following outline. What is endometriosis? What causes endometriosis? How do women with endometriosis actually present? How do we diagnose endometriosis? How do we treat endometriosis? Then we'll conclude. You are welcome to Dr. AK channel. Please, if you have not subscribed to this channel, kindly press the subscription button so that I can get notification on our different discussion. Also like and share. So let's head straight into it. What is endometriosis? The uterus has an inner lining that is called the endometrium. This endometrium grows every month, every cycle in preparation for pregnancy. So if pregnancy does not take place, this endometrial lining actually dies, shed, and it's revealed as menses, as a monthly period. However, if by any reason this tissue that is similar to the inner lining of the uterus is not present outside the uterus, like on the muscle of the uterus, on the surface of the uterus itself, on the tubes, on the ovaries, on the bowel, on the bladder, even on the lungs, brain, and even the navel, that is called endometriosis. That is the presence of a tissue that looks like the inner lining of the endometrium, of the inner lining of the uterus, elsewhere outside the uterus, is called endometriosis, and is shown to affect 1 out of every 10 women and affecting about 180 million women globally. So, what causes endometriosis? We do not know the cause of endometriosis, but there are different theories that have been postulated. There is theory of what we call retrograde menstruation. That is, usually when menses usually comes down through the vagina, at times it is suggested that some part of the menstruum can actually go through the tubes and then get spilled into the abdomen. Then when it gets there, it can now implant and then cause matching of the bowel together, matching of the tissue together. We call additions. But this does not explain how endometriosis can now go as far as the lungs, as far as the brain, but it's a theory. Also, it's been said that it's actually running the family. So if there is family history of endometriosis, it's actually a risk factor. So how do patients with endometriosis present? They present with pain, worsening menstrual pains that may not even make them to go to work or go out to fend for themselves. Such pain usually not amenable to the usual painkillers. They usually have painful sexual intercourse in which the pain actually outweighs the pleasure of sex. Is a clinical presentation. For about 4 to 7 of every 10 women with infertility have been said to have endometriosis. So they do present with infertility. For patients that have these endometriotic lesions elsewhere outside the birth canal, like say on the bladder, they can present with monthly cyclical bloody urination that I call hematuria. Those that have this lesion present on the lungs can actually cough out blood every month. That is called hemoptysis. Those that have this present on the brain can actually have serious monthly headache and it can actually convulse. They can convulse. And those that have the lesion on the navel can actually bleed monthly. But unlike the menses that has a tract of flowing down through the vagina and reveal as period, those that are located elsewhere may not have a chance to flow out. Like the one in the abdominal cavity does not have anywhere to track to. So they tend to change the accumulation over the time. The blood will change color and then cause the gumming of the structures around them together. That is called addition. And this actually wasn't the pains and may even is actually one of the causes of the fallopian tube blockage. So how do we diagnose endometriosis? We diagnose endometriosis by taking detailed history. We examine thoroughly, then we do pelvic examination, and the gold standard for diagnosis is called laparoscopy, in which we create a small incision on the on the tummy, close to the navel, then introduce some long probes with camera attached to their head to actually see the inner structures and see where this endometriosis is located. That it can be actually be treated or for diagnosis. We still get back to it when we get to the treatment. So how do we treat endometriosis? Usually, if a woman has painful and worsening painful menses, you talk to your doctor. Speak to your doctor. It may not pain should not be that pain is not it's not bearable. So you see your doctor so that it can actually be guided to ameliorate this pain. So we use medical treatments, which could include use of painkillers like the anti-inflammatory drugs, the NSAIDs, actually usually effective. Then you can also use the birth control pills that contains hormones that actually reduce this endometriotic deposits everywhere. Then we can also use another drug that is known as progesterone. We can be given as tablets, can be given an injection, and can even be given as insertion that is known as intrauterine device. Is placed into the uterine cavity. What they do is actually to reduce the endometriotic lesion. And also that's what we call GnRH. It looks big, but just understand how it works. How it works is that it helps reduce the secretion of hormones that regulate menses from the ovary, such creating what is called artificial menopause. That's very key. So breast surgery could be diagnostic and could also be used as form of treatment. So what are the indications for surgery for patients with endometriosis? If the pain is not ameliorable to the medical treatment, such patient will need surgery. If there is infertility because of the kinking of the tube, the twisting of the tube due to the additions of the endometriotic lesion on the tube. So doing surgery will help remove those disease conditions and then straighten the tube so that air can actually be transported through the tube and it can have them fertilized during normal sexual intercourse. Also, as a result of progressive accumulation of the blood in the ovary, if the lesion is located on the ovary, there is what we call endometriotic cyst. It's called chocolate cyst. Can be so big and may probably need surgery for its treatment. Please note this: endometriosis is not cancerous. Endometriosis, any condition that will reduce or stop menses, like breastfeeding, like pregnancy, and menopause itself, it actually ameliorates the symptoms of endometriosis. So in conclusion, endometriosis affects 1 out of every 10 women. So if you see any woman that is having serious and worsening menstrual pains, they have sexual pains in which the pains actually overrides or supersede the pleasure, please kindly see your doctor. I hope you have learned 1 or 2 things from this video. Please, if you have not subscribed, kindly subscribe, press the subscription button so I can get notification. See you at our subsequent video release. Thank you.